CDC now monitoring 6 people diagnosed in the U.S. this week with rare cases of monkeypox. Here to answer questions is Dr. Ali Raja, Deputy Chair of the Department of Emergency Medicine at Mass General. As always, thanks for being with us, Dr. Raja.
Great to see you,
Thanks,
Dr. Raja.
Thanks,
Your colleagues at Mass General are now treating one of those cases, as we have been reporting. So what can you tell us about it? What do we need to know?
Well, so I have to tell you, I have learned a ton about monkeypox in the past 48 hours. And it looks like, in addition to the case here in Massachusetts, the CDC is now tracking 6 or 7 cases, potential cases around the country. And there's been a small number of cases in Canada and Western Europe as well. So the thing to remember is that it's a virus related to smallpox, and patients can have fevers, headaches, and muscle aches. They're pretty nonspecific symptoms. But what's characteristic is those lesions on the hands and feet that if you Google monkeypox, you've already seen.
Yeah.
I think the thing that I've been talking to people who have coming in concerned is that the risk right now of transmission to the general public is very, very low. People just need to know what the symptoms and the signs look like so that if they start noticing anything, especially those lesions, they should get checked out.
Well, got to imagine countless reasons people head to the ER, but are you talking to your staff about the risk of potentially seeing more cases? You're saying don't worry too much, but you talked about the symptoms. What are you telling your staff?
Eric, it's a great question. I mean, it's our job to be worried about and ready for anything. And so after the patient who was diagnosed earlier this week, we've been working with our infectious disease specialists and our emergency preparedness teams to not only make sure everybody is ready and knows all about monkeypox, the kind of things that I just talked about and more, but also so that our protocols, which are always in place, are tightened and ready in case somebody who actually meets the criteria comes in. But again, I just want to emphasize to everybody, the chances of that are really, really low.
Dr. Raja, we're also learning this week that the CDC has now identified 180 cases of severe hepatitis infections in otherwise healthy children. It's an increase from roughly 109 cases about 2 weeks ago. So are health officials any closer to figuring out the cause?
Yeah, it's a really good question. So first of all, that 180 number is a little bit tricky because what the CDC is doing is doing a bunch of investigating, and a lot of those cases that are going up from week to week are actually retrospective cases that they're finding from as far back as like October of 2021. So a few months ago that they're now finding and they're adding to the list. So these are not all new cases that have come up.
Got it.
They're still looking into a number of potential causes, one of which is the adenovirus, which we've talked about before. It usually causes the common cold, but it's turned up in about half of the cases of hepatitis that have been found.
Okay, well, and I guess the focus is kids younger than 10. So what do parents need to know?
So first of all, the risk is really low, and some of the symptoms are pretty nonspecific: fever, nausea, vomiting, belly pain. But the symptom to focus on, that I've been telling my patients and friends about, is jaundice. So yellowing of the skin, yellowing of the eyes, or darkening of the urine. If you start noticing those symptoms in particular, call your doctor or head into your local ER.
Dr. Raja, thanks for the reminder. Thanks for your time. Great to see you.
Thanks, Ed and Erica.
Have a great weekend.
Yeah, thank you, doctor. And to our